a coma and brain death?
Create different levels of consciousness. Anybody who doesn't have this awareness is in a coma state. In coma, though the most of the reflexive, in more deep coma, the most vital reflexes. But in a brain death condition, even
Why can't a brain be transplanted?
his body can be theoretically utilized to connect it with the fellow who has been completely crippled. You have an injury and then you do something called as a nerve grafting. If the nerve is getting cut.
Somebody develops a brain tumor and there is a change in the personality of a person. Is there a physical difference in the brain of a criminal and a normal law-abiding citizen? For
Poverty and lack of proper nutrition to the mother translates into an aggressive child. The cell needs a molecule which can tweak and twist around. If you just observe your thoughts, you don't have a control on it, right? When you talk about psychotic behavior, I have the insight that I'm doing it and that is not right. But when the prefrontal cortex is not that capable, then emotions take over.
Something that people are scared about. Seizures.
Yeah. Inadequate sleep, dehydration, or injury, inflammation, infection, or trauma, where continuously it will be seizing, and that's a very life-threatening condition because
I'm assuming it is not possible to cure seizures.
No human is equal that way. Like a predator is there, so it is trying to what you call intimidate you. You also show some emotions. So emotions cannot be controlled, but can be trained. Okay. This is like completely hypothetical now. I mean, how much you can actually do to stay alive. Because
like this food is going to cause this kind of emotions in your brain. Is there something like that?
If I eat this food, I'll become like this. If you start reducing your activity, physical activity, your hemoglobin also gradually starts dropping. But extremely important for the surgical skills, physical skills. What is the point of him being a
neurosurgeon? Yeah.
If you have a real ridiculous passion on one particular thing.
So what about this high IQ?
So I believe that is more important than the IQ and all you talk about. Their testosterone is shooting up and other hormones are slowly building up. But that's why the body is so efficient at getting used to something. You have to degrade that product and throw it out of the system.
Yes. Why is substance abuse dangerous? The same dopamine, for instance, is being produced by the brain. How is that okay? So welcome back to another episode of DoctoPod. This is the third episode and we are here with Dr. Krishna Chaitanya. He is a neurosurgeon practicing in Bengaluru. And in the last couple of episodes, the first one was an intro episode. In the last episode, we spoke a little bit about good habits generally and how sleep affects your brain, why is it important, and different other topics related to the spine, the brain, and how we identify what issues where. We spoke about pain. So if you've not watched that episode, make sure to check it out. In this episode, we are going to talk about a little bit more things like what is coma, what is a brain death. It's actually carrying on from the previous episode where we spoke about sleep and coma, what is the difference between the two. And then let's start off with what is the difference between a coma and brain death.
Yeah. So coma is it's a definition which we have to create different levels of consciousness. Okay. As in, now we are completely aware of the time, what time it is, the place where we are, and the persons, whom we are talking to. So generally when we talk about consciousness, we talk in terms of these three things: awareness of time, place, and person.
Okay.
So in the truest sense of the definition, anybody who doesn't have this awareness is in a coma state. That's what it is. So that's why coma is generally lack of awareness, as you can talk it as coma.
Okay.
Then you have your mental functions, the reflexive functions, autonomic functions working. Okay. But your aware function, where you're actually trying to volitionally think and interact with the surroundings and to people, is not there. So that's what we term as coma. And then in that coma we have different levels of coma, right from being superficial coma to very deep coma as well.
Okay.
Yeah.
So are you saying that reflexes and so on, these things work when somebody is in a coma? Like
yes.
They can actually feel a touch or something like that.
I think like last episode when we're talking about pain.
Yeah.
So whenever we have some stimulus, where it is some hurtful stimulus is there, irrespective of whether we're thinking or not, we move our hand from there, or we, withdraw our limbs from there.
Okay.
So that happens reflexively, without our awareness.
Okay.
So that those reflexes are there even in a patient who is comatose. To some extent, in the sense, in very deep coma, even those reflexes are absent. Yeah.
So a person in a coma can feel pain, is what you're saying?
Yes, he can.
Okay.
He can.
And there's something that I've seen in some these TV shows where when they're checking something, they run a pen under the foot.
Correct.
So what exactly is that, and how, is a person in coma going to be able to feel that?
That is not directly related to comatose condition.
Okay.
Rather than that is related to how our spinal cord, that is once the brain stem finishes and the spinal cord starts. So if there is a problem in that, or if there is a problem in specific nervous tracts, the tracts of the nerve fibers which supply our motor functions.
Okay.
If there's a problem in that, you can assess by that. But that doesn't necessarily tell you whether you're in a coma or not in coma. So it is not a test for coma, basically.
I see. Okay. So then how is a coma different from a brain death?
Yeah. So as I told you, when in coma, the deepest levels of coma, what happens is, though the most of the reflexive mechanisms which are there, they still to some extent are still working. So as I told you about when you pinch, they'll move their bodies, withdraw the bodies, things like that, withdraw their limbs. In that sense, in more deep coma, what happens is those reflexes are lost, but the most vital reflexes, that is the reflexes of breathing, the reflexes of controlling the heartbeat, all these reflexes are still intact in deep coma as well. But in a brain death condition, even the most basic of the functions, that is the breathing function and the coughing function, or even the change of the pupillary pupils, all these basic functions also are completely gone. So that means basically the reflexes which are limited to the brain stem. So in brain stem, all these most important functions are preserved. So these functions are also abolished in brain death. Effectively means that brain death means that there is lack of blood supply to the brain. So then that's the reason why brain has completely stopped functioning, but other organs are getting blood supply.
So it is a coma, but just much worse than that, wherein you cannot have any sort of awareness.
Yeah. Brain death definition itself will tell you about the irreversibility of the whole thing.
It's not reversible at all.
Yes. Coma, can be a lot of reasons for coma. A patient can be having a head injury and that can cause a coma, or you can have an infection to the brain that can cause a coma, or some metabolic problems can cause coma. In these situations, once the offending part, like an infection or a metabolic problem, is corrected, the brain can recover from it. But in a brain death, he can't. Because in brain death, already the blood supply to the brain is completely abolished. And there is no blood flowing to the brain.
So then there are two questions that I have. One is, they say that organs can still be removed from that person if the person is a donor. Typically, if they suffer brain death, the organs are removed and then they are transplanted to somebody else. That is still going to be possible, but does it mean that not all organs are harvestable, sort of?
In brain death?
In brain death.
In brain death, apart from the brain, any other organ can be harvested. Because brain has effectively died. And since we are the whole human being, the whole personality and the whole concept of understanding of a human being all comes from the brain, isn't it? Our perception, our senses, and the way we interact, everything comes from the brain. So in that sense, once the brain dies, it's effectively the person himself is dead, basically. So in that sense, any other organ apart from the brain can be harvested. If it is in a good condition, it can be harvested.
Right. And so brain death is basically just one level above, one level before death. Can that be said? Or it doesn't work
effectively, it is death, if you can ask me. Because without brain, you are not going to survive.
You're not a person.
You're not a person at all.
Yeah.
So effectively it is death. In the sense that if you remove the the life support, they call it. If they remove the life support, he will effectively stop breathing. So we are trying to artificially keep him alive
by
giving him ventilatory support, medicines to keep his heart beating.
Yeah.
So once you remove that, he will die. So brain death has come out of our medical improvement in technology, medical technology, where we are able to sustain the body even after the brain has completely given up.
Okay. And so the other question, then when we were talking about organs, right?
Yeah.
So that transplant can happen. Why can't a brain be transplanted?
Yeah. So again, as I told you before that, the brain is completely, it is an organ as well as the individual himself. Okay.
Yeah.
Because without brain, your whole identity, your whole everything is gone. So in that sense, if you're trying to transplant brain, that means you need to transplant the whole person's head rather. Okay, the whole person's head has to be transplanted into another body. You can't just take out the brain and transplant into another skull. It's not possible. Okay. Having said that, there are some I think European, Italian neurosurgeons who are trying to transplant the head, basically.
Okay.
Who are trying to into a person. The person himself, the fellow who's alive, is completely, say, dependent, quadriplegic, in the sense he doesn't have any movement of his hands and legs and completely bedridden.
Okay.
But otherwise the brain is intact. And then that person, if, say, by mishap of an accident or something, somebody else has had a brain death, his body can be theoretically utilized to connect it with the fellow who has been completely crippled.
Right. Okay. Got it.
So theoretically it can be done. But the problem with that is that when we do that, we have to sever the spinal cord at the brainstem level or at some level. Okay. Now to connect the two, that is the cadaver, the person who's brain dead, his spinal cord to the spinal cord of the fellow who was completely crippled, it doesn't happen that way, because the brain, the spinal cord, though we can connect it, in the sense we can approximate it, inside the connections have to happen.
Yeah.
The neuronal connections have to happen. So that is something which we have not seen happening.
Okay.
And that is the reason why it has not been tried.
And then in the first episode we spoke about the immune response of the body. So
correct. And that also
could be a factor.
Will cause. And that is definitely a factor. But even before that, there are problems, challenges facing how we can integrate the recipient spinal cord to the donor spinal cord. So that's not possible, because it's difficult. It's naturally
too
not
complex.
Possible. It's naturally not possible that spinal cord gets completely integrated like that.
Okay.
Nerve fibers can, in the sense you have an injury, and then you do something called as a nerve grafting. If the nerve is getting cut, you can take another nerve from some other place, and then we can do that, and we can graft the nerve.
But that also is only approximation.
We approximate. No, that's where the definition of peripheral nerve system and central nerve system comes in.
Okay.
When you're trying to attach the spinal cord to the brain stem, that is a central nerve system, and we're doing it for a peripheral area. That's a peripheral nerve system. Peripheral nerve system has a better scope and chance of regeneration rather than this. Central nerve system usually doesn't regenerate that way. That's the reason why we see that a person who has had a spinal cord injury, they usually don't, if there is a partial injury, they will recover the function. But if there's a complete injury, very unlikely they'll recover the function.
So now, doctor, we've heard about this, that, somebody develops a brain tumor and it kind of presses the brain in one way or another. There is a change in the personality of a person. Is that real? Is that possible?
Yeah, it is possible, because what we have to understand is brain is a organ, so and it's a pretty big organ. So every part of the brain relates to some function of the body.
Okay.
Or the person as well. Like, for example, when you're moving your right hand, right, there is a particular area from which the action starts. The electrical signals from there, they start, and then so you're able to move this.
Yeah.
Okay, so that starts from your left part of the brain, some place called the motor cortex. Okay. Okay, similarly, when you talk about sensations, okay, like sensations of touch, pain, and all those things, they are also, all the sensations go to one part of the brain and they get integrated at one place. So, depending on if the tumor is arising at one part where it is pressing on these areas, separate areas, you will get symptoms related to those areas.
Okay.
So, similarly, if a tumor which is probably pressing on the front part of the brain,
Okay.
there's a part of the brain called as a prefrontal cortex.
Okay.
Prefrontal cortex is the most new brain, you can call it as the most newest part of the brain in evolutionary scale.
Okay. Okay.
Okay.
Uh-huh.
So, in the sense that that is the most evolved in human beings.
Okay.
Okay. So, that is the one which usually takes care of the personality of the person, thinking abilities, analytical abilities, all
Okay.
these things, and social behavior, like how to behave in a society. All these things are stationed, or integrated in that area, prefrontal cortex. So, if you have a tumor which is, growing there, then definitely it will cause symptoms in personality.
Okay. So that then brings me to the question, is there a physical difference in the brain of, say, a criminal or a psychopath, a sociopath, and a normal, law-abiding citizen for that matter?
There definitely is, but that anatomical or the morphological difference is not what you think it is. I'll
Okay.
go a little in detail of that.
Okay.
What you have to understand is any criminal behavior, when we consider as criminal because it's aggressive, basically,
Okay.
right? So, or you can say more animal-like. Always when you
Yeah.
consider somebody, he's animal-like behavior, aggressive. So, what are you trying to get from that? Basically, what it means is that the prefrontal cortex, the one which is actually takes care of, as I told you before, the social behavior, how you need to behave in society, and all those morals and ethics and all that, they all are stationed there. So, when the the fetus is growing inside the womb, okay, and if the mother is not unable to get good nutritious food for the fetus, what happens is, the general tendency is that the newest evolutionary thing is the last one to develop. So, what happens in that situation is when the nutrition is not good, not adequate, especially when the baby is developing very, rapidly, not initially, in the later stages, when the rapidly growing, when the mass is being built up in the baby. So, that time when the nutrition is not good, then the earliest, the newest evolutionary thing will get affected.
Okay,
so,
got it.
Because of that, so poverty and lack of proper nutrition to the mother translates into an aggressive child. Because the prefrontal cortexes are not developed that well.
Okay.
And then once, that's why you see that in general, in society, when you have, people who come from a poor socioeconomic status, they generally tend to be more aggressive. I'm talking about in general, it's not that I'm trying to brand anybody.
Yeah.
But you tend to see aggressive behavior more in such states of society.
Okay.
And so eventually that's easy for them to, and difficult for them to actually understand, analyze things, or what is morally right, wrong. All those things are a little clouded for them because their PFC, that is the prefrontal cortex, is not developed well.
Okay.
And that's what leads to criminal behavior. That's what leads to antisocial tendencies and also psychotic tendencies as well. So, this is what, and it has been proven by research as well, that this is what is one of the things which causes this kind of behavior. So, trying to brand somebody saying that is there an anatomical change, difference in the way the brain is actually more than that. It is the way the baby is nurtured in the mother's womb, is how they develop that. Having said that, there is genetic influence as well. So, what I'm trying to say is one aspect of it. One aspect of it is this, and obviously there are other aspects like genetic influence. Somebody who's already whose father or mother are predisposed to such kind of behavior also can give this kind of behavior.
Okay. Yeah. So, a person who has been aggressive has a good chance of having an offspring who is also aggressive, and it is not just the part where the person is the offspring is seeing the behavior in their parent, but also because they are genetically the brain
and
is
then
built
easily
like
get absorbed also. If they see the behavior, and when you have that kind of lineage as well, it gets easily absorbed and incorporated. At the same time, as I told you, if this also adds in the sense, even if the socioeconomic status isn't good and the nutritional status of the mother isn't good, that also kicks in and they'll eventually develop into a...
Okay, so what are the nutritions? What is the nutrition that is important for an offspring or for a fetus to develop their?
Yeah, so there's a very good thing which I have learned recently. It was actually a good thing. How does omega-3?
Okay.
We all talk about omega-3 fatty acids and all those things.
Yeah.
And why that is important in development of the brain and stuff like that. So basically, what are omega-3? Basically, normally fatty acid chains are all single bond carbon atoms which are connected in this.
Yeah, right.
That are called saturated fatty acids because they don't only have single bond.
Right.
Okay, the unsaturated fatty acid means that basically they have a double
two or three bonds.
Either they have a single bond, so it's called a MUFA, mono unsaturated fatty acid.
Okay.
If it is a more than single bond, it's called a PUFA. Okay.
Polyunsaturated.
So now what it does is when you have another bond, okay, that usually the molecule is the bond is unstable because you are sharing the bond with two carbon atoms.
Yes.
Whereas in other situation, it's either shared with a hydrogen or a oxygen or something else.
Right.
So then, because the bond is shared within two carbon atoms, that bond itself is unstable. Okay. Now, because of the instability, there is always an amount of flexibility of the molecule itself is not stable. It will never stay
physically
like
not stable.
Yeah,
okay.
It can tweak and twist around.
Okay, I see.
Okay, we can tweak and twist around, but then the most important fact is that the body needs the cell needs a molecule which can tweak and twist around. Because if you have a completely rigid cell membrane, okay, then nothing can come in, nothing can go out.
Okay.
So the cell membrane has to have some element, some areas where it can turn around. So what happens is there will be a molecule which is here, which some other molecule, and then the fatty acid, unsaturated fatty acid is here. It will turn around a little bit. So it can goes inside the cell.
Okay.
Similarly, something comes out. So it becomes semi-permeable.
Okay.
So semi-permeability is essential for cell to live. Otherwise, nothing comes in, nothing goes out.
Yeah.
So omega-3 creates that semi-permeability. That means the double bonds and the triple bonds create that instability in the molecule, which makes it semi-permeable.
Okay.
Instead of having a rigid fatty acid chain which covers the whole cell, there will be here and there will be some amount of twisting of the molecule so that the other outside and inside exchange keeps happening. So omega-3 gives you that.
Okay. So and what is folic acid?
Folic acid again is a vitamin. It is a vitamin which helps in the development of these
So there are these things, right, that they say that you need DHA, folic acid, and these are all
nothing but omega-3.
Oh, that's omega-3. Okay.
Yeah, DHA is nothing but it leads to that fatty acid chain, which keeps the cell membrane supple, so that that is necessary for the good functioning of the neuronal cell.
Okay.
Yeah, and that you get from fish.
Right.
I mean,
primarily from
fish and other.
There are some algae that have been found to have this thing, and then flax seeds and.
So one of the good examples I have learned from, YouTube. I was going through one of the videos. He was a very good example of that. So why do you think that the fish survive so well even in a very freezing water? That means the water is 4 degrees centigrade.
Yeah.
You know, if you have an ice sheet on it, and then you have fish which is still alive inside 4 degrees. And having said that, fish also need use the same blood, which is red in color and everything.
Right, warm
and the same cell membranes. Because of the presence of these omega-3 in plenty there.
Oh, okay.
The fat, the layers, the cell membranes don't get stiff. There still be some tweaking and turning around. That's because of that they are able to survive.
Interesting. Okay.
And that's the reason we also need that. Now, why did I come to this? That is, you talked about nutrition and this thing. So you need all that for our health, well-being of the neuronal cell as well.
Got it. Okay. Now that brings me to from personality. Your personality is defined by how you feel emotions and how you respond to them.
Correct.
Thoughts are basically what trigger these responses, reactions. So how does thought work in brain?
Yeah. So if you just observe your thoughts, what happens is you don't have a control on it, right?
Okay.
Like for example,
I'm not, yeah.
when you're not really focusing on anything,
Right.
you randomly just sit and then you'll have random thoughts coming in,
Yes.
going, coming in,
Yeah.
going. The reason for that is, I'm just hypothesizing because there is no proper, evidence for this. Okay. Is that the one part of the brain, the prefrontal, what I talk about, the frontal part of the brain, the prefrontal cortex, has a different resting membrane potential than the other parts of the brain.
Okay.
Understand? That means to say that now, for example, as I told you before, that the RMP has to be 70 millivolts, minus 70 millivolts in prefrontal cortex. Okay, that is this part. Okay. Probably because there is no evidence yet. Okay.
Right.
Probably the prefrontal cortex resting potential is more than minus 70. That means it is minus 30 or minus 20 or that.
Okay.
So what happens is it needs lesser stimuli to actually start sending a signal.
Okay.
Okay. So what happens in that sense is even a little fluctuations in the neuronal membrane will trigger a impulse. And once it triggers an impulse, depending on your previous neuronal pathway, the way it is, it will send a signal in that particular pathway. And also to some around that collateral nerves also will get that signal, and then that leads to thought basically. And depending on whether that will make it interesting or not.
Yeah.
Now the interest is a emotional. That's where the emotions come in. The interest or non-interest is a limbic system. Limbic system is called basically it is an emotional part of the brain.
Okay.
That's more primitive. Okay.
Okay.
The limbic system is more primitive. So it is mammalian brain, you can talk. So all the mammals and some of the reptiles, they can make out whether you're angry or you're happy. Like you can make out whether a dog is happy or angry.
Yeah.
Without interacting, you can actually make a dog.
Yes.
Similarly, a cat or any other mammal for that matter. So that's a mammalian brain, the limbic system. So that's how mammals interact, or generally animals, especially reptiles, also interact with emotions. Okay. That's their language. We develop this language. Okay. But still, we can understand because we are mammals. We can understand that language.
Yeah.
So if the limbic system starts to show interest in that particular random thought, then you hang on it and you focus on it and you develop a new thought, and that goes on.
Okay.
So my hypothesis is that based on the lower threshold of the prefrontal cortex neurons, it gives rise to thoughts randomly, and then you, based on your limbic system and other affiliation, the way you are living your life, you can either use that thought or you get lost in that daydreaming basically.
Right. So my brain has caught onto a couple of thoughts now.
Yeah.
One, with respect to the psychopaths and, the brain. Is there a relation between a so-called criminal's brain and, the mirror neurons that they have? Is it possible that they are not able to feel what the other person might go through because of their action, and that's why they end up doing something? Is it like, let's say that if I were a criminal and I'm just slapping somebody on the road, right? I cannot feel or I cannot make out the embarrassment, anger that the person would go through.
That's very true in the sense, whatever we are discussing are on the fringes of our understanding about the brain and the neurosciences.
Okay.
That means that when you are talking about a fringe, information, or a technology, you can always, hypothesize because there's nothing firm there.
Yeah.
So in the sense, when you talk about psychopaths, that whole realm is psychiatry. Okay. So neuroscience, the amount of neuroscience evidence is pretty minuscule. Okay. So in that sense, I talked about the prefrontal cortex and the lack of that causing aggressive behavior and all that.
Okay.
So that has been seen, in some studies.
Okay.
Okay, so coming back to your question, what was it? I just
The mirror neurons.
mirror neuron. So when you talk about mirror neuron, again that was a hypothetical neuron which we don't know.
Acha, okay.
So what we understand, I mean, from psychiatry, is to talk about insight. So psychotic behavior. When you talk about psychotic behavior, that doesn't have insight. So anybody when he has a psychotic tendency, they don't have insight in what they're doing. Okay, that means that there's another set of behavior called as neurotic behavior. So in psychiatry, we have this kind of a delineation between a neurotic behavior and a psychotic behavior. In neurotic behavior, you have insight. Okay. Like for example, somebody has an OCD. Like I have an OCD of always keep checking what I've already done.
Yeah.
I have the insight that I'm doing it and that is not right. But you have a tendency that you still you have the urge to still go and check it.
Yes.
But a person who's psychotic will not have that insight that what he's doing is not correct, but he still does it. Okay. So in that sense, he can still probably say if he has a favorite hero or a sportsman, he can still probably enjoy a match. But probably when it comes to doing something which he probably thinks is not wrong, he may still do it. All that again comes in, it's in the realm of psychology and all that, about what you think is right and wrong, all those things.
Okay.
Basically.
So is it fair to say that psychology is primarily dealing with the prefrontal cortex?
Yes, it is more or less.
Okay.
Psychiatry also. Prefrontal cortex as well as the associated limbic system involved.
I see. Okay. Limbic system
because emotions also play a big role in
this. Definitely. Yeah.
Because what happens is when the prefrontal cortex is not that capable, then emotions take over. That's why you get aggression when this is not holding you on. So relax. Nobody's there. There's no coach trying to say, relax, don't worry, it's okay. You'll get your chance, and then try to cool you down. So there's no coach there. There's no, that white angel who's trying to say that don't do things.
Yeah.
So the devil is just on the rampage. So that's what happens basically.
Also, when you were talking about the membrane potential, in the previous episode, we spoke about hypertension medications, which end up increasing the potassium and reducing the sodium.
It reduces the sodium.
Increases the potassium.
Kind of. It reduces sodium basically.
Okay.
Yeah.
Is it somehow causing somebody to feel something less and more? Could it make somebody feel something less and more?
It could. Hypothetically, it could, because we are again here talking in terms of, I think I told you in the first initial introductory lecture about the chaos theory, where we start something, even if there's a small change in the initial trigger, the cumulative thing at the result can be different.
Yes.
So similarly, we are all nonlinear systems.
Okay.
So maybe in some people where there is a pronounced effect of the sodium being low, it probably can give a particular end result. Yeah, it's possible. We can't completely say no, it's not.
Yeah. Okay. So moving away from this topic into something that people see and they kind of are scared about, seizures.
Yeah.
What are these?
Yeah. So seizures are basically explosive electrical signaling from the brain, and synchronous explosive signaling. From the brain.
What do we mean synchronous?
Synchronous because when you see a person seizing, you'll see that they will start moving their limbs and all that rhythmically. So there is some kind of synchronicity also.
Okay.
So what happens is usually that again this is not very clear because we are just talking hypothetically because we're not seeing it. There is this much is for sure that there is a trigger always. Okay.
Yeah.
There's a trigger. And that trigger basically has a neuron which is very irritable.
Okay.
Irritability can be, again, as I told you before, irritability if inadequate sleep, dehydration, or injury, any kind of injury, inflammation, infection, or trauma to that particular brain area will irritate the neurons as well. So once the neuron is irritated, the membrane potential, the threshold reduces. So as the threshold reduces, even a smallest of the stimulus can trigger a explosive signaling. So that signaling sometimes what you call, instead of just being localized, will, depending on, some, the pathways, because everything is connected eventually.
Yes.
So that can start a complete generalized, what you call, a stimulation of the entire brain, causing seizing. And when you have a generalized seizing like that, then you'll also lose consciousness. If it's a focal seizing, you lose consciousness, because the reticular system is not involved. It's only at one area, like that. So seizure is basically that. And then once sorry to disturb, once that seizure, gets terminated, okay, then he'll have that confusion and all that, then slowly he'll get back to normalcy. Okay, it usually gets terminated because continuously when you signal, as I told, the NAK, ATPase, everything will get saturated, and then no more signals can go.
Yeah. So nothing is coming in also for them at that.
Having said that, there are some situations, it's called status epilepticus.
Okay.
So where continuously it will be seizing, and that's a very life-threatening condition, because the membrane, which is the most important part, that because of the continuous seizure will get completely damaged.
Okay.
The sodium, potassium pumps, everything get completely disarrayed, and then patient can die if you don't immediately stop the seizures.
Seizures, okay. So is this true for all seizures? Are seizures that dangerous always?
Seizures can lead to dangerous situations.
Okay.
And in the seizures, there are some seizures. Any seizure is dangerous because you suddenly lose consciousness. You may fall down. You may, especially if you are close to a fire or something, that you can catch fire, or you may catch a electrical thing, whatever. So seizure itself is dangerous. So to prevent it is most important.
So since we don't fully understand seizures, I'm assuming it is not possible as of now to treat seizures or cure seizures.
Yeah. So what we do is basically, since we know that seizure is happening at the level of the membrane potential. Yeah. There is a problem in the way the cell is, hypersensitive to some kind of a stimulus, and that's why it is suddenly discharging, right? So what we do is we use drugs to stabilize the membrane. Okay. So all the anti-epileptics we talk about are all membrane stabilizers in general. In general, they're membrane stabilizers. So that's the reason why the seizing action comes down.
It's not possible so far to cure seizures, but they can be managed as well.
You can manage, yes, you can manage it. And sometimes there will be some genetic abnormalities. So how do you correct that? So we always have been struggling with gene therapy and all that. Still, we have not come to any therapy in that sense. So, yes.
Now, apart from the science of seizures, there is also some taboo associated with it, right? That somebody gets the seizures and, they are not seen as equal humans for some reason. What is your thought behind that?
No human is equal that way.
Okay.
The idea is that humans should be respected with whatever their abilities are. Somebody might be having much better abilities than the other. Yeah. So yes, I mean, seizing itself doesn't cause human intelligence to come down. Yeah. Okay. But in some situations it can. Okay. But in general, seizures can be managed with medication, and the person can live a completely normal life. Okay. So yeah, and that's completely wrong to make it as a taboo. Definitely, it is wrong, and we do have taboo for everything for that matter. So I guess our mindsets should change in that sense.
Okay, so now coming from seizures back into emotions, we now kind of have an idea about how our brain perceives emotions, what causes these emotions, and how they are related to thoughts. How does the brain perceive positive or negative emotions, or to use a more modern terminology for it, pleasant and unpleasant emotions?
Yeah. No. So basically, emotions, as I told you before, it was a primitive language for us, animals, basically. Yeah. Okay. Over that, we have created a proper detailed language which we have created. Yeah. Okay. But other than that, I guess if you even come down to our siblings, rather, you can talk like chimpanzees and apes.
Oh, okay.
Even they do have some kind of a language, but still the predominant language is emotion. Okay. Okay. Because with emotion, I can easily either, show the person who's trying to offend you, or say your own, friends around, whether I'm receptive to your interaction or not receptive to your interaction, or some other, what do you call, like a predator is there. So it is trying to, what do you call, intimidate you. You also show some emotion. So it is a direct, language basically. So it's you're interacting. Interspecies interaction basically can talk.
Right.
Or, even intraspecies as well. So in this, when you talk about pleasant and unpleasant emotions, then you can easily quantify it. No? So fear is an unpleasant emotion.
Right, yeah.
So and fear is the most basic, and that worry also is a kind of fear. So it's just a spectrum basically. Similarly, pleasant emotions also are there. So as I told you, if you can understand emotion in the context of it being a language across species, mammalian species. So I guess you can probably have a better idea about that in that sense.
So then, can we control emotions? Should we control emotions?
Emotions cannot be controlled, but can be trained.
Okay.
And for that matter, brain is a very trainable organ. Okay. So in the sense that, for example, initially, one particular, say somebody is wisecracking on you from behind or somewhere, your friends.
Yeah.
Initially, you may feel very angry about it. But your prefrontal cortex is telling, "Boy, it's okay. He's just trying to, what do you call, make fun of you, just to make him feel, better." So if you kind of analyze it, and then later on you can prime and train your mind saying that don't react to it. It only. So maybe gradually after a period of time, you'll stop emoting, isn't it? When that guy says the same.
Reacting, yeah.
You start reacting to it. So, eventually what happens is whatever that fellow is doing to you, you will not react to it. In fact, you can even smile about it and just pass on. So, I think probably the answer to your question, you can train your emotions, but you can't really shut it down.
Yeah.
Having said that, suddenly you may have another reaction which you're not trained to. So, you may again show some emotional outburst. And that stays. Usually emotions, they stay for a couple of minutes or to an hour or half an hour or so. Yeah. And then they gradually pass away.
So then you said that there is an entire spectrum. So fear, and then in that spectrum of fear you have anxiety, worry and so on. What are willpower, courage? What are these things?
Okay. This is like completely hypothetical now. In neurosciences, willpower, courage. I guess this is, if you ask me, because since you asked me this, I never thought in terms of trying to analyze it in a neuroscientific way.
Okay.
But if you ask me, it's a combination of your analytical abilities, which stem out from the prefrontal cortex, this part, and your limbic abilities of aggressiveness, how much you can actually do to stay alive. Because eventually we all have that ability innate in us to stay afloat, irrespective of all the problems inside.
Yeah, self-preservation.
Self-preservation. So it's a combination of that where your prefrontal cortex is analyzing the situation and your ability to execute it, and how much you can sustain it is your courage or willpower, you can call it. But having said this, I will tell you one thing, that willpower also is a limited supply. It's like a resource. So you need to use it very judiciously. Okay, so that's one thing I understand. So usually, say for example, what we have seen is that willpower and your ability to do well is usually best in the mornings when the brain is fresh. Okay, so try to do things which needs a lot of willpower mornings, in the morning times.
Okay, so if you're starting a workout, you should be doing it in the morning, in the initial days at least.
So that you get that habit forming first.
Yeah.
So always, I think it's better to do that way rather than the other way around, I feel. Having said that, if you're not utilize your brain too much, if you aren't too tired in the evening, you can still do it in the evening.
Yeah.
So what I'm trying to say is not a dictum. It's a very fluid thing.
Yeah.
But generally it is this way, basically.
Got it. Is there a way how food works with our brain? So, this food is going to cause this kind of emotions in your brain. This kind of food is going to cause this kind of emotions. Is there something like that?
I personally don't buy to that concept. Because because a lot of this concept is there, especially among in YouTube and all. We keep seeing that,
YouTube is full
this
of
diet is best for this and that and this.
brain diet.
I do believe that food is important.
Yes.
But I take a little more radical outlook to it. Okay, like say you have animals. I don't know. I just always, because I don't believe that we are any different from animals.
Sure.
So they eat whatever is available to us.
Them. Yeah.
They still lead a normal life according to them. Then why are we so fussy about that? This food is better, that food is better.
So,
having said that, as I told you before about the nutrition for the mother. So the necessary nutrition, if you are supplying, the brain will take what is necessary
for it.
That's about it.
Yeah.
It doesn't mean that if you just eat this nutrition, you will become that. You should have the innate ability in the brain pre-wired. That is genetic. It could be genetic or it usually is genetic, wherein this particular genetic framework, in order to implement it, it needs some resources. So that resources are coming from the nutrition, the food, what you are taking. So if you don't have that genetic blueprint to do one particular way, no matter how much resource you put inside, it is not of any use. So having said that, there is a lot of play in the genetic thing where you can also acquire some amount of traits over your lifetime. In the sense you always talk about, you can always enhance your intelligence by practice and stuff like that.
Yeah.
So that also is there. Definitely that is there.
The brain is one organ, like you said, it is trainable. It actually physically changes whenever you acquire a new skill.
Correct. So initial is genetic blueprint, yes, you need to have, as well as if you are able to train yourself over a period of your lifetime, then that will definitely help you. And in that sense, proper food which will aid in this, your building up of your system will definitely help.
So, so you mean to say, like, when somebody's, their electrolytes should be in balance, things like, your omega-3, these things should be present and so on. Other than that, don't overthink it.
Don't overthink it is one. And the general tendency of people is that if I eat this food, I'll become like this.
Yeah, like if you eat, okra or lady's finger, you'll do well in that.
It's not like that. Basically, without the actual performing of that activity, if it's not there, then no matter how good food you eat, it doesn't make any difference.
It's not going to make a difference.
It's like having a car full tank full of petrol and not
knowing
driving
how to drive.
Not knowing how to drive or not driving
at all. Yeah.
And saying, no, see, so that's not the way. Same thing in even if you say keep on taking calcium supplements and vitamin D supplements, and then saying that still nothing is improving, because you're not doing any activity to actually let the body take that. A small example for that is, I have seen in some patients as well as in general life, that if you start reducing your activity, physical activity, your hemoglobin also gradually starts dropping, because your hemoglobin is basically a molecule which will supply you oxygen, right?
Yeah.
So your physical activity is less. So your body starts understanding that this much of hemoglobin is not necessary for this fellow.
Yeah, let me not worry too much about it, and it just stops. Yeah.
So it happens not just in hemoglobin, in everything. It happens that way.
Protein and
everything.
Yeah.
Disuse atrophy, you call. You have muscle which you are not physically engaging it with some activity or intense activity, it will shrink.
Yeah.
That's exactly what happens.
Okay. So tell us a little bit about intelligence, doctor, because now we spoke about the prefrontal cortex for the humans, it being the most, it being the newest thing to develop. Yes. So is intelligence related to the prefrontal cortex, or is it
Intelligence is, again, it's a composite thing. It's not only limited to the PFC. And the PFC is not that it's a separate entity. Again, it is connected completely through and through with all the, vision area, the hearing area, everything. So it's again an integrated thing. We just talk about PFC because that's where the actual analysis happens. But it keeps taking cues from the other places also. So coming to your question, intelligence, it's in a composite thing. For me, intelligence is basically a self improvement property. In the sense, intelligence is utilized in trying to make use of the situational understanding for the person's own benefit or the individual's own benefit.
Yeah.
That's what is intelligence. So intelligence doesn't mean that it can be physical intelligence. Okay, it can be like language intelligence. Some people are very good at, playing with words. Some people are very good at, tinkering with things. So intelligence has a different, again, it has multiple spectrum of things. So that's my take on it.
Okay. So what about this high IQ? What is high IQ? Is it something, is it a thing, first of all, high IQ?
I think the whole concept of IQ in the West, when they started all that IQ tests for kids, was in order to screen them for, because their particular job profiles needed some amount, like say accountants, you had clerks, you had this and that. Aptitude. So in order to understand which kid can perform well in that particular, based on their job profiles, they created this. Okay. But having said that, I don't personally buy to that IQ thing. It gives you a general overall, understanding that this fellow's analytical abilities are good or apt, things like that. But what happens is, a lot of times that you, again, I told you before, you're virtual and real. You're basically there.
Yeah.
So you're putting a number to it, but that number actually doesn't make any sense.
One number cannot define
you at all.
Yeah.
Okay, it probably defines you in one particular aspect of it. That's about it.
Yeah.
Okay, because I have seen personally, there are great orators are very poor in their physical skills. Now, for example, a neurosurgeon is there. Okay?
Yeah.
Now, if a neurosurgeon is a great exceptional orator, but extremely poor in the surgical skills, physical skills, what is the point of him being a neurosurgeon?
Neurosurgeon, yeah.
So, where does the IQ go now? Got it. So, trying to brand something, define something as this and that will not actually tell you who you are or what that fellow can do.
Right, and since you said that intelligence can be of different things, then you cannot measure one thing and then say his IQ is low, but then that fellow might be the greatest sports star ever.
Exactly, and then in this situation, the choice that fellow is making, that's most important. And then the passion, the interest, like I personally believe in this, that if you have a real ridiculous passion on one particular thing,
right,
what happens is your whole brain is focused on that. Then even if your IQ is low, your bloody whole brain is focused on that. So no matter what happens, you will excel in that.
Right.
So where does the passion come from? It's curiosity, it's interest. That's a limbic action, thing. Limbic, because even animals have that curiosity.
Right.
So that's a limbic thing. So I believe that is more important than the IQ and all you talk about. Okay? Because once you're focused on one thing, you zone out completely.
Yeah.
Because you're totally into it.
Yeah.
So, unfortunately, but for us, when you try to, in general, when you want to, grade people and kids, so that, because we have very limited jobs, limited seats everywhere. So, you have to
have a system.
Have a system, basically. Yeah. But if you try to use that system very rigidly, then
it's problematic.
Yeah.
And also, since let's say that in 2020 somebody's IQ might have been something, but then
it will change. Yes.
Yeah, it'll change.
And IQ also can be trained. For example, now the IQ test which we have, if you do those so-called different geometrical thing and the symmetries and all that, if you keep training, your IQ can easily jump from, say, if you have 110 to 130 easily within a matter of couple of
years.
Not even years, 6 months or something. You train your IQ to improve. So it's trainable. So what are you trying to show here? Got it. So that's the thing.
Cool. Yeah. So now from that, let us just have one more topic for this episode, which is drugs, substance abuse. How does substance help, or how does substance work with brain? That's one. Two, what leads to, or what starts the substance abuse?
Yeah, I guess substance abuse. So when kids, I mean, obviously, because it all starts with kids, right? Or kids, or maybe teenagers.
Teens, yeah.
Teens, where when they two things, probably two things. One is because of their situation there, and they're growing, their testosterone is shooting up, and other hormones are slowly building up. And if there is a stress somewhere, like say in a familial stress or inside itself, you may have a stress as in a friction, where you're not able to conform to what the society is trying to tell you, family is trying to tell you.
Okay.
Then,
Dissonance.
Yeah, dissonance. So in that sense, he wants to have a get away from the reality in which he is in.
Yeah.
That's one. One of the ways they get into this is that. And the other is probably they just want to explore newer, experiences.
Curiosity.
Like more or less all these, hippie culture has kind of started from there. They want to experience new sense of, realities. So that's where, this substance abuse have started off, where that it gives them newer sense of experiences. Just like alcohol gives you disinhibition. You take a little bit of alcohol, whatever little social inhibition you have, saying that, oh, should I talk or not? Yeah. Should I open up or not? That completely falls flat once you take a little bit of alcohol, and you become very garrulous. You talk and you emote. Yeah. That's what happens when you see people who are, they'll follow you, and that. So that's what happens. So that's a different reality from their actual reality. So if their actual life is not giving them that pleasantness, they will obviously try to use this, and they'll keep on going into this reality, the pseudo reality which they have, by using substance abuse.
Okay. Now, there is also this thing called as a threshold, right? So a person's threshold keeps changing. So for instance, somebody is abusing dopamine, right? Today they are going with, say, X micrograms of dopamine. And then after a point, it stops affecting them in any way. So they have to now increase. Why is that happening?
Again, that's where the body is so efficient at getting used to something.
Okay.
It's like diabetes is one example for that.
Okay.
So what happens is, because when there's more sugar flowing in the blood, there is more insulin to tackle that extra sugar, to try to push it into the cells, especially non-brain cells. Okay. So now gradually what happens is that extra insulin also is not able to push the glucose out of the bloodstream.
Okay.
So that's the reason why you develop insulin resistance.
Yeah.
Okay. So that's a natural tendency of body to do that kind of a thing. So gradually, why that happens is basically, it's again, a lot of things are not very clear about it, but this kind of a resistance does develop. Sometimes it is due to, if you're taking like a substance or a drug. Once you start taking a drug, it metabolizes. It has to metabolize. In the sense, you have to degrade that product and throw it out of the system.
Yes.
Like say, alcohol is one example. Initially, say, a person gets high after one peg. That one peg becomes 2, 3, 4, 5 later on. That's because your liver is trying to actively metabolize it and throw it off.
Okay.
So
it gets better at
that, and it also that enzyme which is necessary for that metabolizing, it increases. That's why you develop resistance to it. So you need more than that. So similar to that, even other chemicals also, the same way.
Okay. Now, why is substance abuse dangerous?
It is because not physiological, basically. See, this alcohol is not physiological to our body. Neither is, say, other, steroid, cocaine or things like that, LSD.
Yeah.
They're not physiological. So they interact abnormally to the normal molecules which are there in the body. It will either increase the function too much or decrease the function too badly. See, life is basically hanging on basically balance.
Yeah.
So that's what the great man said before. Buddha, it's all about balance. Neither of the extremes is good for life. So when you use a substance abuse, the balance is tilted to one side. It's either like alcohol, it depresses the neurological function. Okay. Whereas the other stimulants like cocaine and all increases the neurological function very severely.
Yeah.
So that imbalance always causes problems later on.
So what is that term? Homeostasis.
Homeostasis.
So the body tries to find that, and then everything goes off balance.
Life is the best you can describe life as basically it's a balance between either of that. So we need to tread that path in life.
So, but then the same dopamine, for instance, is being produced by the brain. How is that okay?
No, that's what I'm saying. See, dopamine, as I told you
In the previous episode,
that if you are, to form a healthy habit, you need some incentive, right?
Yeah.
So the incentive is dopamine.
Yeah.
Okay. So that incentivizing is there in the brain itself. Okay. If you don't have incentivizing, then you'll not go for a particular, to perform a particular task.
Right. You need to feel good about whatever.
Exactly.
You do. Right.
So, but then now if you start feeling good about the negative things or bad things, then that is not good for the body. See, like you incentivize jogging because it improves cardiovascular function also, everything, and even memory, brain also. So they're all good things. But again, there also there's a balance. If you do too much of that, you can crack your bones. Everything can happen, go wrong. You've seen people dying out of marathons and all that.
Yeah.
So you need to understand where your limits are and stay in the limits. Balance is
no matter what, whether you're getting dopamine from your own brain or from outside, you need to know what the limit is, and as long as you stay in the limit, you're good.
So you need to incentivize the body through normal physiological actions rather than artificial things.
Right. And that is why you should be typically avoiding the artificial things, because then if you increase your threshold too much to the artificial stuff, your internal one
and it will become lethal eventually.
Yes, it will become lethal. Yeah. Yes. So with that, we wind up this episode. Thank you for watching so far. If you like what you watched, what you heard, please ensure to hit the like button and subscribe to our channel for more like this coming in the future. Thank you, Dr. Casey. Thank you for being with us.
And if any explanation you feel that it is inadequate, you please let us know
in the comments below, and we will
still try to explain it in a better way, I guess.
Definitely.
I guess always an explanation is better when you give analogies. So that's why I try to give analogies and then try to explain the hidden understanding behind it.
Yes, and all of this talk that is happening, this is unscripted. This is just things coming out of his brain and mine.
Yeah.
If there are more brains like yours, which can come up with more ideas,
please feel free to.
You have questions,
to
please. Yes, please put them in the comments below, and we'll try and address those comments.
Thanks.
Thank you for watching, and have a good rest of your day.